Now that you have learned about our program, surgeons, and staff, let's see if you're a candidate for surgery with Missouri Bariatric Services. First, you must be at least 17 years of age. The second requirement is a body mass index greater than 40. Body mass index, also known as BMI, is a measurement of your body fat. To calculate your BMI, please use the BMI calculator on our website at www.muhealth.org/weight-loss-surgery and click on Calculate BMI. If you have a BMI greater than 35, you may be a candidate if you also have additional serious conditions such as life-threatening cardiopulmonary problems, severe diabetes, or high blood pressure. The third requirement is a previous attempt at non-surgical weight loss therapy, such as a diet plan like Weight Watchers. We also require that you be very well informed about the potential risks of having weight loss surgery, so you must attend educational seminars before and after surgery. Finally, you must comply with our program requirements after surgery, which we will talk about later in the presentation. We cannot stress this enough. By following our program, you will have the best tools to succeed at long-term weight loss. After you watch this presentation, the next step in the process of having surgery at Missouri Bariatric Services is to call your insurance company. If you have Medicare or Medicaid, you don't have to call. However, if you have commercial insurance, please contact your insurance company as soon as possible. The phone number to call should be located on the back of your insurance card. Please ask at least the following 3 questions. Is bariatric surgery a covered benefit under my current plan? If bariatric surgery is a covered benefit, please ask, what are the requirements to qualify for bariatric surgery? Many insurance companies require you to try a medically supervised weight loss or other diet plan for a certain length of time. Please ask your insurance company what they require before surgery. Also, when talking to your insurance company, ask, what is the fax number my healthcare provider needs to use to submit my request for insurance approval? These 3 questions are important to ask because the types of covered healthcare procedures vary among insurance companies and the types of employers they insure. Also, your insurance company is more willing to share information with you, their client, than with us, so we must rely on you to obtain this information. The last thing you want to find out right before bariatric surgery is that your insurance does not cover it. And please do not attempt to submit your insurance approval on your own. Some companies limit the number of denials and only allow a certain number of submissions. Finally, you must be seen in our office before a request is submitted to your insurance company. The next step in your journey is the completion of the Missouri Bariatric Services Patient Information Packet. Inside is an orange sheet that lists all the forms in the packet that need to be completed before you make your first office appointment. They include medical history, nutritional history, personal information, the latex allergy questionnaire, and the primary care physician referral form. You may complete all the forms except the primary care physician referral form. It must be completed by your primary care physician. Once all forms are complete, you will be ready for your first office appointment. To schedule it, please call our clinic. You will speak to one of our patient service representatives who will discuss the process and schedule your appointment. You must bring all completed forms from the checklist in your patient information packet to your first office visit. Please do not fax or mail any paperwork to us. If you do not have your forms completed and with you, we will have to reschedule your appointment. Also included in your new patient packet is a map to the Missouri Bariatric Services Clinic. Please note our clinic is not located at University Hospital. At your first clinic visit, you will see our bariatrician, Dr. Kevin Sutmiller. He will help ensure you are the safest possible candidate for surgery and also help you meet the needs of your insurance company. During your first appointment, Dr. Sutmiller will discuss what diagnostic tests you need before surgery. Depending on your health status, these may include an EGD, upper GI, CAT scan, cardiac stress test, ultrasound test of your legs and/or abdomen, a sleep study, and a pulmonary function test. You may have these done at University Hospital or at your local hospital. If you prefer your local hospital, your primary care doctor will need to order these tests for you, and the results will need to be faxed to our clinic. If you wish to have them done at University Hospital, we will be happy to order them for you, and the results will be sent to our clinic automatically. If we request a test you had within the last year, please bring a copy of the results to your next clinic appointment. We will need to receive the test results to clear you for surgery and submit the information to your insurance company for approval. It is of the utmost importance that you are mentally prepared for the surgery you are about to receive. Missouri Bariatric Services and most insurance companies require a psychological evaluation before your surgery. The evaluation must be performed by a licensed psychologist or psychiatrist. It cannot be completed by a caseworker or social worker. Included in your new patient packet is a green sheet, which lists the specific information that needs to be addressed during your evaluation. Please share this form with your psychologist or psychiatrist at the beginning of your appointment. No mental health diagnosis will automatically exclude you from having surgery. However, failure to mention your mental health history to the psychologist or psychiatrist conducting your evaluation may result in removal from our program. We request your honesty so that we can treat you to the best of our ability. After your initial clinic visit and psychological evaluation, the next step is submission of your information to your insurance company for approval to have surgery. Missouri Bariatric Services staff will submit the paperwork called a letter of predetermination. Please do not try to send this letter yourself. It must be sent from Missouri Bariatric Services. We will send you written notification when your letter is submitted. Please be aware that every insurance company is different, so the requirements for surgical approval vary. In some cases, 6 months of medically supervised weight loss may be required, or a long history of non-medical weight loss attempts, such as Weight Watchers, will need to be submitted. This is why it is very important for you to contact your insurance company before your first clinic appointment to make sure you have completed all requirements. Typically, it takes 2 to 3 weeks for the insurance company to approve or deny your surgery. Most often, they will contact you before they contact Missouri Bariatric Services. If you wish to check on the status of your request for surgery, we encourage you to call your insurance company. After we receive approval from them, our office staff will contact you. If your insurance company denies your request for surgery, our office will notify you by mail. If you have been denied because of a lack of documentation or requirements have not been met, our office staff will do everything we can to ensure that these requirements are fulfilled and then resubmit your request for surgery. However, if you are denied because your insurance company does not cover bariatric surgery, our clinic will not be able to appeal the denial. We will be happy to make recommendations on how to navigate insurance appeals.